the baby, you should go to the chest examination. Yes, the shape of the chest, any deformations, the condition of the clavicles. Yes, then I should do the auscultation of the lungs. Yes, and according to the movement of the chest, you should evaluate the respiratory rate. Yes, in 1 minute. Then auscultation of the heart, 5 points of the heart. Then also you should calculate, or you should examine the heart rate. Then palpation of the abdomen. Yes. Superficial, deep palpation. Yes, palpation of the liver and spleen. Yes, and in the spinal position. Yes, when baby in the spine position, you should evaluate the reflexes in the spine, searching reflex, then for example Babkin reflex, palmar grasp, and Moreau. Then for example when it's in the vertical position, yes, you should evaluate the reflexes of the supporting reflex and the automatic stepping. Yes, and in the prone position you should evaluate the crawling reflex and the gallant. Okay, then you should go to the after the you should go to guys.
Yes, doctor.
Yes, yes.
What, Abdul Ghani? I asked that they will. I said that there will be 3 stations again. Yes. Then in these 3 stations, like one station, you should do 5-7 minutes at least. Yes, 7 minutes, but it should be 5-6 minutes. Okay. All station you should start from the greeting yourself. Yes, from the asking permission, sanitizing the hands, sanitizing your fundoscope, and your nails should be clean. Yes, your white coats should be ironed, should be also clean, white, long white coats. Yes, not short one, because you know, yes, the head of our department, Gauhar Mijbaina, will check your appearance by yourself. So for then you should have fundoscope, medical cap, gloves. Yes. Yes. According to the taking, they can be given physical examination, and also they will be given. Yes, you can see here. Yes, for example, please do physical examination of the patient, of the healthy newborn, or the patient with rickets, or patient with iron deficiency anemia. And the third station is the interpretation of the labs and the instrumental tests. Yes, also for example, they will be given the disease. Yes, please evaluate or interpret the labs and the instrumental tests of the baby with iron deficiency anemia. And for example, while you are doing physical examination, yes, you should tell the leading syndrome. For example, yes, according to the complaints and physical examination, the leading syndrome is something like this. And for example, in history taking, also according to the complaints history taking, This one is something like this. Okay. Is there any questions?
But ma'am, in other disciplines, we have to say the final diagnosis in the diagnostic station only.
For example, yes, it is not diagnosis. It is what? It is leading syndrome. Yes. For example, if there will be VAP, yes, with the with what? With the complaints of maybe the paleness of the skin, irritability, yes, the low appetite, yes. For example, mother can come to you with the complaints, yes, of the low appetite, irritability, crying, yes. You should take history, yes. Then, according to the history and physical examination, maybe in physical examination you observe some yes, some things, yes, maybe the pale skin, yes, that there was the dryness of the skin, maybe the nails was also some changes, and they should tell according to the complaints, according to the history taking and physical examination. I think it is, for example, anemia or anemic syndrome or other syndromes, yes, according to the physical examination of the patient. And according to this, as I think that it is anemic syndrome, maybe yes, I need such service plan, yes, see biochemical blood test, urine analysis, yes, if there is needed, for example, according to the anemia, maybe other investigations, yes. And then you will tell, if you see, for example, low iron serum, if you saw low ferritin, yes, you can tell that final diagnosis is iron deficiency anemia. Maybe it was because of the, for example, during the pregnancy, mother also have anemia, or maybe parents of the patient not breastfeed but give, for example, cow milk. Yes, it also can cause the iron deficiency anemia, giving the cow milk. Okay. About diseases, yes, there will be only iron deficiency anemia disease and rickets. Other diagnosis is a healthy newborn, and that's it. About how can we tell about syndromes? Syndromes we can tell about, like, for example, according to the iron deficiency anemia, yes, you should tell what? You should tell according to the, for example, yes, you find somewhat, you find dryness of the skin, yes, you find maybe other symptoms. Then you should tell that according to these symptoms, I think it is anemia, not special iron deficiency. Yes, I think it is anemia. For example, 1 second. Guys, mute your. I don't know who is. I mute him. Okay.
Ma'am, can you please explain the checklist?
Checklist of what?
Pedia. Pediatrics.
There are a lot of checklists. What checklist do you want?
In so many ma'am, in those checklists, there is a point mentioned about the assessing of psycho-emotional assessment of the child. Yes. So how we will do that?
Okay, in psycho-emotional or neuropsychic development of the patient, yes, they will be also given the baby, yes, for example, 7 months, 9 months, 10 months old, yes? According to the age of the patient, you should evaluate the development. So gross motor skills, fine motor development, social and language skills. First of all, yes, you should present yourself. You should greet, yes, tell them, hello, or good morning, good afternoon, good day. My name is Firuza and I'm your doctor. Please tell me your name, yes? So she's telling my name is Anne, yes? Okay, nice to meet you, Anne. What is your name of your son or daughter, yes, of the child? What is the age of the child, yes? After it, you should tell that, you should start from taking anamnesis, yes? You should ask the numbers, yes? Gravida, para, yes? What is your number of pregnancy, number of deliveries, yes? After the, you identify, yes, assess the numbers of the pregnancy and delivery, you can ask what, for example, you should explain the purpose of the examination and ask for the permission, yes? After the asking the permission, you should sanitize your hand, yes, sanitize your, for example, phonendoscope with nap, yes. Then you should start from what? From evaluating the neuropsychic development, yes. First of all, you should evaluate, I don't know, can I tell you about it, but okay. One second. First of all, you should assess what, for example, even it is, you should assess visual, yes, ability. For visual ability or visual reaction, you can just check, for example, even ask, yes, from the patient, if it is maybe not according to the age, yes. If it is 7 months or 9 months, you know that there is a separate anxiety, yes. Or if you, for example, take some maybe toy, yes, and the show, baby will lead with eyes, yes, and see this toy. Then you should evaluate the what if after it. What should you evaluate? Do you know?
Taste, hearing ability.
Yes. So after the visual reaction, yes, for example, recognize familiar people, yes, maybe shows a feeling of maybe curiosity, yes, anxiety. Then child can see not only large, yes, but also small objects. Then you should evaluate the auditory reaction, yes, or hearing ability. Maybe, for example, we can make some sound and the baby will turn the head toward the sound, yes, or baby will turn the head toward the voice of the adult, yes. Then maybe baby will react differently. For example, when, for example, name of this baby is Tom, yes. When we're telling Tom, he will, yes, react to the name. And for example, when I will call his mom, yes, for example, Anne, he will also react differently, yes. Or make some sounds or gestures, yes, when he or she hears her name or his name, yes. Then you should assess emotional reaction, yes. For example, what? Quickly responds with a smile to some conversation, yes, when I am telling hello, and the baby will smile, maybe, yes. Then, for example, when I'm telling something to the baby, yes, hello, or something like this, and in other case, maybe mother call the baby, yes, baby can able what? To switch his attention if he is distracted, yes. For example, he is looking at me, baby, and I'm telling hello, then his mother is calling, yes, Tom, and he can be distracted, and it is emotional reaction, yes. Then negative reaction to the stranger. Maybe, for example, I'm a stranger for the baby, yes, I'm a doctor, so this baby can, for example, can give negative stranger or joyful, yes. Maybe if, for example, baby will like me, he will smile, etc. Then you should evaluate the what? Evaluate gross motor skills, yes? Assessment of what? General motor activity. For example, if it is 9 months, 8 months, baby will cross well, yes, a lot, fast, in different direction, yes. Then evaluate the baby according like gross motor activity. And what? Fine motor skills. For example, in my 9 months, it can pincer grasp, yes. In 9 months, gross motor skills, baby can crawl, yes, or stand with support. Then you should assess speech activity. For example, at 7 months, at 9 months, baby can babble, yes, pronounce some syllables, yes, syllables. Then also you can assess, for example, speech comprehension. For example, yes, when I'm talking something, yes, and I can tell them, where is your toy? And baby can look, yes, to find, for example, some object. Okay? Then you should assess what? Assess the skills of eating, drinking, maybe for also it is what gross motor skills, yes, drinking from the cup or etc. Then assesses what? Neuropsychic development. You should clearly identify what? Visual analyzer, auditory analyzer, emotions, yes, then movements, yes, actions, so gross motor skills, fine motor skills, general movements, social skills, and language skills. That's it. It is neurological psycho skills. Is it clear? I told everything that you should tell me.
And ma'am, can you explain what is required in the physical examination? Like we have 5 minutes only, so what we can do in there?
You have from 5 till 7 minutes, yes, till 6 minutes. Okay, in physical examination, yes. First of all, also you should greet yourself. My name is. What is your name? I'm going to examine your baby. Please let me do the physical examination. Yes. After the asking the permission, you should sanitize your hand. Yes. Then sanitize your fundoscope. Do not forget fundoscope. Yes. Then you should evaluate what? Evaluate the general appearance of the patient, the presence of the obvious malformation. Yes, macrocephaly, microcephaly. Yeah, just you should tell, yes, observing the general appearance of the patient, observing the obvious malformations, yes, Down syndrome also it's obvious, macrocephaly, the big head also obvious, yes. Then you should evaluate the skin, the the color of the skin, is it clean or not, the presence of any birthmarks, any rashes, petechias, then the humidity of the skin, is it dry, yes. Then after the skin, you should evaluate the subcutaneous fat. For example, if it's baby even term, yes, full term, the development of this full term, yes, can be maybe preterm baby. And you know that in preterm baby there is a thin fatty layer. So you should evaluate the subcutaneous fat, the thickness, the turgor, yes. Then you should evaluate the condition of the umbilical cord, yes, of the umbilicus. Is it clean? Is there any hyperemia or is there any infection in the umbilical cord? Okay, it is the umbilicus is clean, for example, yes, it's clean, dry, it's okay. Then you should start to evaluate the head of the patient, yes. Head, the form, the shape of the skull, the hair formation, the formation of the sutures. Yes, you should palpate. You should know how to palpate sutures. You should palpate the anterior fontanelle, posterior fontanelle. Then you should Then you should go to the spontaneous activity of the patient. Yes, muscle tone of the patient. Even you can do maybe traction test when you elevate baby, and baby first do like this. Yes, then baby also elevates the head. So it is traction test. It can tell us that the muscle tone of the baby is good. Yes. Then you should evaluate the abdomen or chest. Yes, in chest, the shape of the chest, any deformation, the clavicle, the mammary glands. For example, in some babies, they can be transient condition. Yes. Mastopathy, they can be swelling of the mammary gland. So you should evaluate the shape of the chest, any deformities, clavicle, mammary gland. Then you should start to do auscultation of the lung. Yes. For example, in the right side, you should do whole. Yes. Till the 6 intercostal space, even 5, 5, 10. But in the left side, yes, till 2nd intercostal space. Then ask me about a mother to hold like this and do in the back of the back side of the patient. Yes, auscultation. Then you should evaluate the count, auscultation, respiratory rate. You can tell that if you have time. Yes. Evaluate, or you can tell that I'm evaluating the respiratory rate in 1 minute according to the movement of the chest. Yes. Then after it, you should evaluate do the auscultation of the heart. Then after the auscultation of the heart, you evaluate the heart rate, yes, of the patient. Then you should do the palpation of the abdomen, deep palpation, superficial palpation, seeing any tenderness, any painless, yes, palpation of the liver, palpation of the spleen of the baby. Then after it, you should what? Then you can start to check reflexes. Yes, in spine position. Yes, you can check searching reflex, snorting reflex, Babkin reflex, and the grasping reflex, and the Marrow reflex. Yes. Then you cannot tell when it disappears. You just check, okay, these reflexes. In a vertical position, yes, you check supporting reflex, then stepping reflex. In prone position, you check crawling reflex, and you can also check gallant reflex. Yes. Then you should check what? Urinary system. Yes, you should check. It is external genitalia. Yes. Examining the external genitalia, you should tell the external genitalia developed like in female patient. Yes. Then checking why we check, for example, mouth in the end of the examination, because baby can cry. Yes, so you should check the mouth, the lip, the color of the mouth, the gums. Yes, then pharyngeal wall posterior. Yes. The tongue. After it, you should ask the mother of the baby how baby like urinates. Yes. You should ask baby, for example, about the baby mother about the stool, about the urination after the first 24 hours after birth. Yes, and the character of the urination, the frequency of the urination and stool, and the management of the newborn. Yes, you should evaluate the tactics that they should be breastfeeding, baby should be breastfeeded, they should be outdoor walking, yes, in the fresh air. And in 1 month, you should go to polyclinic to have to have physical examination, to have physical assessment, and to assess the body weight, length, yes, to assess how there is a gaining of weight and length. Okay, and then said that your baby is healthy. So please, do you have any questions? Goodbye. That's it. The number of checklist, 1 second, number of checklist. 11. I can, Abdulghani, I can send you if you want. So like there is a rickets, yes, 3 stations with rickets, yes, checklists. It is history taking of rickets, physical examination of rickets, and interpretation of the rickets. Then the fourth is the iron deficiency. Also, history taking iron deficiency, physical examination iron deficiency, and interpretation of iron deficiency. Yes. Then there is a assessment of neuropsychic development. Then it is inspection, yes, and also reflexes, examination of the full-term newborn, healthy newborn, and also questioning of the mother with healthy full-term newborn. You shouldn't forget that in infancy, in childhood, in pediatrics, it is important to ask about pregnancy history. Any diseases during pregnancy, infection, abortion, miscarriages, torch infection, toxoplasmosis, rubella, HIV, smoking history, alcohol using history, drug using, medications, maybe that mother take, any other complications, maybe there was anemia, yes. For example, in iron deficiency, it's important to ask, was there any anemia, for example, yes, or maybe there was eclampsia or preeclampsia, yes. Preeclampsia, it means that there was a high blood pressure, yes, and also maybe some protein in the urine. Now they will the examiner give marks? No, no, I think we will give you marks immediately. For example, while you will be answering, we will put marks, yes. Then after you finish, for example, there is a total 20, yes. You will get 20, maybe 15, 19, 18. Then you will have papers with 15 stations, and for each station, you will be given points. For example, for pediatrics, you get 19, 20, 18, yes. Then you go for first station. For the second, also, for example, you got 18. Then for the third station, you got 20. Then you go to the next discipline. For example, I think you all were told that for also musculoskeletal, yes, system, also 3 stations. Questioning, physical examination, interpretation of lab, and instrumental test without prescribing treatment, yes. And also will be given the diagnosis, yes. For example, as I said before, physical examination of patient with monoarthritis. And you should do, based on this, you should need to conduct this examination. And also the same in the pediatrics, they will be also given physical examination of a patient, for example, with iron deficiency anemia, yes. And you should know what in iron deficiency anemia that there will be changes, yes, and you should know what kind of changes should be in iron deficiency anemia. Yes, I think you know all. Do you have other questions?
Yes, ma'am. Ma'am, there is a separate checklist for reflexes, and in that there's a point given, give a detailed conclusion about the neurological condition of the baby. So what should we be explaining there?
For example, if it's there is all reflexes presented, yes. For example, if it's 2 months and all reflexes will be presented, it is okay, yes, because most of the reflexes disappears from the second month, yes, in the third, fourth, etc. And you should what? You should tell that according to my physical examination, according to the examination of the all reflexes, I consider that your baby is healthy, yes, and it is only you should need to do it is breastfeed your baby, outdoor walking, regular medical checkups, and that's it. And ask, do you have any questions? If there is no question, say, if it's all understandable to you, okay, goodbye. That's it.
Okay, thank you, ma'am.
Yeah, cute, man.
Any questions?
Can I, Doctor?
Yes, please, Abu Bakr.
Good afternoon, Dr. Fayruza. Dr. Fayruza, I have to ask you about the treatment. We have to write the dose also or not?
No, there is no treatment.
Okay. But if I will add it, like I will say to the examiner, I will get the point, extra point or not?
You will not have any time to have to give treatment, because you have only 5-7 minutes. You will only will have time to say that according to the, for example, CBC, biochemical test, etc., etc. I think it is iron deficiency anemia, and according that you, for example, in pregnancy you have anemia in anamnesis. Yes, you got iron deficiency anemia. Your baby had. And you should evaluate the stage of the anemia, yes, according to the hemoglobin in erythrocyte. Is it first stage, or is it moderate or mild or severe anemia?
Okay, thank you. Thank you.
There is no treatment.
Doctor, what about reference ranges?
I think there should be reference ranges. I hope that there will be reference ranges. About atopic dermatitis, no, there will not be atopic dermatitis, because atopic dermatitis, there is no even this topic in your syllabus when you have pediatrics, so there will not be any atopic dermatitis. There will be healthy newborn, physical examination of the healthy newborn, then there will be reflexes, yes, neurological, then assessment of the neuropsychic development of the patient, then iron deficiency anemia and rickets. I think easy one is going to be pediatrics. About reference ranges, I think it will be given reference ranges. But
okay.
CBC, urine, biochemical. In CBC, there are a lot of, yes, reticulocytes, erythrocytes, MCHC, MCH, MCV. And that's, I think, yes. For example, in maybe rickets, there will be X-ray, yes. Rosary, yes. Synthetic rosaries, yes, they can be, for example. Other questions, because we have 3 minutes.
Yeah, for example, in reflexes, should we ask all the reflexes, or we should look first at the age of the baby and then decide like which reflexes a baby should have and which shouldn't?
I think my hint for you, yes, my advice for you, to tell all reflexes, because I think they will put the age of the baby like this, that all reflexes will appear in this baby. Okay, for example, it can be 2 months. In 2 months, all reflexes can present.
Okay, thank you.
But doctor, the time is too much short. How we can management everything? Physical examination and reflexes.
No, physical reflexes will be in other station. Yes, for example, reflexes will be in 5-7 minutes. It is you can do reflexes in 5-7 minutes. Then physical examination. In physical examination, yes, reflexes you should check, but only several reflexes. Don't worry.
Thank you.
Okay, guys, I think you will all do good if you study good during lessons. Yes, during your lessons, just refresh your knowledges. Also, in reflexes, neurological reflexes, you should tell the time when it disappears. Okay, so you should know when it disappears. Any questions? No jaundice. There is no jaundice. I think there will be jaundice, but there is no checklist of jaundice. Only iron deficiency, rickets, neuropsychic development, reflexes, and the healthy newborn.
Ma'am, while giving the final diagnosis for the rickets, do we need to speak like what is the stage of this rickets?
Yes, you should need. For example, yes, according to the condition, according to the clinical feature, you should know what is the peak period, yes, what is the stage, yes, is it mild, moderate, severe? You should know the stages.
Okay.
Okay, doctor.
I think there is no question, yes? Okay. If you have questions, you can write and ask. Goodbye. Good luck.
Hello, check mic check.